It's an honor to be with you today and support these fundraising efforts for the MHMR Authority of the Brazos Valley. Your donations, of course, will ensure that the Authority continues to provide high-quality services to members of our community who are challenged with mental illness, learning disabilities, and developmental delays. I like the slogan of this event, Minds Matter. Two simple words joined together to make a powerful statement. A statement that I hold dear as a father, and as a physician, and as a member of the Texas legislature. From an early age, I learned that minds do matter. Growing up in Abilene, my mother worked as an MHMR nurse. She came home at night and shared stories of the challenges her patients faced. I listened intently and came to understand and empathize with those who struggle with their mental health. Through no small coincidence, after high school I pursued degrees in the healing arts, first in pharmacy and then in medicine. With each additional year of pharmacy and medical training, I became more aware of the types and severity of mental health illness that exists in our communities. Those who suffer, those who cling to hope, and those who need our help. Then, mental health became deeply personal when members of my own family battled various mental health issues and illnesses. Thinking back, I believe they were fortunate. Fortunate they had the support of a loving family, had access to the services that they needed, and had the opportunity to receive treatment early on in life. And I know that not all of those who suffer from mental illness are equally blessed. It is with this background that I entered the legislature less than 4 years ago, 2011. And from the beginning, I've committed to making mental health one of my top legislative priorities. During the 2011 legislative session, our state, still reeling from an economic recession, faced a $27 billion budgetary shortfall. And as a member of the House Appropriations Committee, I fought to maintain mental health funding at a time of severe cuts to every aspect of our state budget. This was no small task, but fighting for mental health was the right choice, the only choice, because minds do matter. In the 2013 legislative session, I am pleased to report that the Texas legislature renewed its commitment to mental health, increasing mental health funding by over $350 million. This additional funding is reducing or even eliminating wait lists, expanding access to mental health services, and providing for prevention and early identification measures. Last session, I also passed the legislation that makes mental health first aid training available at no cost to Texas teachers. Sandy Hook Elementary, Aurora, Colorado, Tucson, Arizona, Virginia Tech. The common denominator in these tragedies is perpetrators with a history of mental illness that fell through the cracks. They did not receive the mental health treatment they needed when they needed it. And so the goal of mental health first aid is to increase the awareness of mental health disorders in our communities, diminish the stigma associated with mental illness, and help our teachers maintain a safe school environment. And I'm pleased today to tell you that after just 1 year in existence, mental health first aid training has now been given to over 5,000 Texas educators in Texas. This early identification and prevention and intervention is a key first step in preventing the next tragedy. And we must recognize that mental health is something that deserves our undivided attention and support. In 2013, that was a starting point, but we still have work to do. Looking forward, what are the next steps? As a member of the Sunset Advisory Commission, I and my other fellow members are currently charged with performing a thorough review of our health-related agencies to ensure that these agencies are working effectively and efficiently. We have adopted recommendations to increase the capacity of inpatient psychiatric beds for those with high levels of needs, better integrate our mental health and substance abuse services, and streamline how we allocate regional mental health funding. As a state, we need to embrace the innovations in mental health treatment that are taking place at the local level through the 1115 transformation waiver. Local crisis teams are working to divert the mentally ill from our ERs and jails to mental health services in the community, a more appropriate treatment setting that also saves taxpayer dollars. Case management and enhanced outpatient services will help keep individuals from cycling back into our emergency rooms and criminal justice system. Additionally, we need to address our mental health workforce shortage, particularly in rural and underserved areas. We simply cannot provide appropriate services without an adequate supply of mental health professionals to keep pace with the growing demands and needs of a growing state. Together, let's build on the progress we made in the 83rd legislative session, because minds do matter. Mental health care matters for the individual, for the family, for the community, for the taxpayers, for the people of Texas. I pledge today that I will be your advocate, and ally, and champion in the Texas Senate as we address mental health issues today, tomorrow, and in the years to come. Thank you, and God bless you, and may God continue to bless this great state of Texas.